Ladies and gentlemen, good morning. It's my true honor to be here to share our experiences with you in China. And I'm from Beijing, and my organization called United Family Healthcare. And actually, my CEO is invited for this conference. Unfortunately, she's busy with Chinese government. So coming here on her behalf to share our experiences. United Family Healthcare was founded in 1997, and it is China's first and largest foreign invested health provider. And it has 6 hospitals and 14 satellite clinics and medical centers throughout Asia. The city coverages in China, including Beijing, Shanghai, Tianjin, and Qingdao. We have over 11,000 inpatient admissions and over 400,000 outpatient visits. Our Beijing hospital opened in 1997, and Shanghai Hospital opened in 2005, then followed by Tianjin Rehab, Intermed, and Qingdao Hospital. We have more than 1,000 medical staffs and 800 nursing staffs. Our medical staff are coming from 25 different countries and regions, including India. We provide a medical service for all stages of life, from preventative medicine, and prenatal, obstetrics, pediatrics, general and medical specialties, and rehabilitation, home care, and hospice as well. We are medical pioneer, and we are piloting a lot of new procedures. For instance, we are doing da Vinci surgical procedures. We also provide IVF service. Our hospitals are JCI accredited, and our Beijing hospital lab is accredited by both JCI and the CAP. Healthcare in China. China was a pioneer for family medicine and prevention. In 1950s, barefoot doctor was introduced in China. And in 1970s, there were almost 1 million barefoot doctors. They are not registered, and they were not well educated, have very limited medical knowledge, working in the villages, giving vaccination shots, helping delivering baby, and treating medical infectious diseases. They really made up for inadequate medical resources for China for that specific period. In the past 3 decades, there's a huge social transformation happened in China. We pulled out 600 million people out of poverty. At the same time, there is a huge change and improvement in health. Since the launch of health reform in 2009, the Chinese government has invested a huge amount of money to expand infrastructure and to establish almost universal healthcare insurance coverage, and promote more equal access to public health services, and established a nationwide national essential medical system. A baby born in today can expect to live 30 years longer than the baby born 50 years ago. This is very fast and quick transition change phase. In the developed countries, this change probably took longer than our time. Now we are facing the new changes. Aging. We have 140 million people aged over 65. This number is predicted to change to 230 million in year 2030. And the increasing burden of non-communicable diseases, and also high health risk factors behaviors such as drinking, smoking, and bad lifestyle, bad diet, together with the environmental factors such as air pollution, they are strong force behind the emergence of chronic diseases. Also, traffic safety is another challenge as well. So non-communicable disease is the #1 health threat in China. It accounts for 80% of 10 million deaths every year. This is a randomized study showing the pattern of awareness of disease, diagnosis of disease, and the treatment of disease, as well as control of disease. We can see that high blood pressure, 33 of high blood pressure were not well controlled, and 7% of diabetes were not well controlled. This is an international study showing the control of high blood pressure comparing with other countries. China was 8%. It's not good. In the smoking, we can see 50% of males aged over 15 are daily smokers. This is a shocking number. And we can see this is alcohol consumption. China is not so much concerned about the alcohol consumption. However, there was a significant trend increase in the past 10 years. Okay. This is international comparison of medical expenditures per person per year to keep life expectancy. We can see China spend about $1,000 to keep a life expectancy of 68 age. And on the other side, US is a little bit extreme. Spend $9,000 to keep a similar life expectancy. Japan and Singapore are doing better. They spend less than $4,000 to keep a life expectancy of 75. Come back to UFH. We started our EMR journey in 2003 and put in English system. In 2008, we decided to replace the system. The simple reason is the single language system and the difficulty integration of system no more longer meet our clinical needs and serve business expansion. Then we spent 5 years to digitalize everything, and now we are at the stage of clinical adoption, applying evidence medicine in the system and refining workflows, better support, integrated and organized care. And we are also researching and piloting value-based care. Okay. Our system is patient-centered. One patient, one system, and one database. It is bilingual, support 2 languages, English and Chinese, and putting standards. For instance, we use SNOMED for terminology, use ICD-10 for diagnosis, use CPT for procedures, and use MIMS for drug interaction. We also set up a standard workflow for same specialty and subspecialty across all the clinics and the hospitals. Every physician can easily access our system at any time from anywhere. For instance, from hospital computer, from personal computer, or from smartphone. We use cloud technology. Our database and application are installed on our private clouds. Every clinician has to use electronic keys, that keys we call authority key, to make sure our paperless clinical documentation is legally protected. Of course, we comply with local regulation. And last, also very important for us, is our system is not a limit for clinical documentation. And we have to seeking clinical decision support and seeking clinical intelligence. Data is transformed to information if we understand the relationship. And information is changed to knowledge if we understand the patterns. And then knowledge are upgraded to wisdom if we are able to figure out the principles and the logicals behind. Nowadays in healthcare IT, we are data-rich, information poor, and we don't have adequate bedside real-time clinical decision support for value-based care. Recently, British Medical Journal has published an article saying that medical error is the 3rd leading cause of death in the US. Every day we work in the system, we always encounter a situation that is no matter how much effort we're trying to put on, we are not able to continuously improve our quality. There's a chasm there. The chasm is our care system is not well organized. Our experiences of applying evidence-based practice is we're trying to add best research evidence to our system. And on the other side, we're trying to bring physicians as much as information we can about the patient allergy problem, medication reconciliation, results, reports, and a diagnosis, treatment plan, lifestyle, and preferences. And hopefully we can build in genome data very quickly. And we're building up-to-date in our system. And this helps physicians to quickly find out research evidence that is relevant to patient-specific conditions. And the use age is not as high as we expected. However, physicians' input are very, very encouraging. Okay. Every day we apply innovation. And we have to think and balance 3 factors: human, technology, and the business. Every time when we design workflows, we have to think about, when we design workflow or clinical system, we have to really think about and assess what is the human usability and desirability, what is technical feasibility, and what is the business efficiency. Recently, Chinese government has launched another round of reform, very much deepening people-centered integrated care. And the private health sector encouragement is very much emphasized in the strategic plan. The final outcome from all these actions is really a transformation, transforming from volume-based care to value-based care. Our philosophy. First is simplicity. Elegant simplicity is gold. Second, from product side, we pursue interoperable, reliable, intuitive, and scalable. Always keep human factors in mind, because all the technology support our clinician, and the clinicians serve our patients, our consumers, and our citizens. We consider our vendors as strategic partners. We always focus on bigger goal, work hard, and trying to work smart. Trying to introduce 2 books. These books really helped us a lot. It's Inside the Physician Mind, to help us common ground with the doctors. Second book we call is Beyond Implementation. This will teach us how to last EMR adoption. And I always love these 2 animals. I think a team having characteristic of these 2 animals can always work hard and work smart. Everyone is dreaming a system, a smart system for ourselves, for our loved ones, for our children, for our grandchildren. A system which is always prepared, transparent, open, innovative, inclusive, efficient, competitive, engaging, and connected and responsive. And how can we contribute to this transformation? As a healthcare innovator, and we have learned, and we change our way to think, and always think beyond healthcare as health, beyond hospitals to the community, beyond quality to value, and very much practical and important for us is beyond the record, the intelligence, and the decision making. Thank you.